The proportion of Americans 65 and older has quadrupled over the past century, with 1 out of 6 of us having now reached or surpassed the age of Medicare eligibility. And by the year 2040, more than 1/5 of Americans will be over 65. In tonight's Tough Questions, we begin a series of reports focusing on this. What are the healthcare implications of having such a large older population?
Geriatric medicine in the very beginning of it was more developed for the end of life care. And as our population has grown healthier and we're living longer, now that shift has, it's just completely different how we're treating patients now in geriatric medicine. Now we're all about healthy aging.
Demographers estimate that by the year 2040, more than 80 million Americans will be 65 or older. And if you're a part of that demographic, you'll probably be seeing a doctor who specializes in geriatric medicine, which is specifically geared toward treating the unique health challenges of older people.
I get patients that are 65, they haven't been evaluated by a doctor in 10, 15 years. So unfortunately, we're playing catch up, right? A lot of these patients have diabetes and they don't know it. They have high blood pressure, they don't know it.
Dr. Ismael Rodriguez is an internal medicine physician at University Medical Center who works with many older patients. He says their health care often involves more complexity than the average adult because older patients often come with multiple chronic conditions that may have gone undiagnosed for decades and only become known because of a medical emergency or unusual aches and pains that finally get them to the doctor's office. But he says geriatric medicine has gotten a lot better in recent years in treating patients living with multiple medical conditions.
We've gotten really good at treating not only individual medical conditions, but we can pinpoint and select what medications will be best depending on the patient's risk factors.
For example, Dr. Rodriguez said an older patient may have a kidney condition or heart problems along with a disease like diabetes. And the art in his profession is finding the right medications and the best dosage combinations to effectively treat each condition while minimizing side effects.